Good morning. Thank you so much for attending. Thank you so much for attending our Hot Sheet Live. Where is the money? This is part 9, believe it or not. And today's topic, I'm so extremely excited about it. It is contact tracing, a new business opportunity for MBEs. I know that we have been living in a coronavirus pandemic bubble. And as we look to educate our minority businesses, our corporate members, everyone, all our stakeholders, family, and friends around the pandemic as it relates to a business perspective, we thought this was an appropriate topic. And so, welcome. I'm Sharon Pender, President and CEO of the Capital Region Minority Supply Development Council. We're going to go ahead and get started. We have a lot to cover today. And so, I hope that you are ready for a content rich pack hour, and it will just be 1 hour. You have already gone to the refrigerator. It's 5 o'clock somewhere, as we always say, and you've already fixed your mimosas and Bloody Mary. You've grabbed that coffee, stay out the refrigerator, and we're going to get going here. Before we get started, I do want to thank our sponsors for today. Of course, the U.S. Department of Commerce, MBDA, but we also have other sponsors such as Exelon, BGE, Pepco, AMCUS, CompuGain, GDC Events, SB and Company, Stroud Priest, the Hilton, BAE Systems, the State of Maryland. We thank you, along with the Board of Directors of the Capital Region Minority Supply Development Council. So let's get started right away. I'm going to bring on our panelists, and I want to just share with you just all the subject matter experts that we have on hand today. So I'm going to ask them to come on camera if they would. Good morning, good morning, good morning. Everybody's looking great. We're waiting for one more person, and that's the person I'm going to start with. But before I start with the bios, take a look at the agenda. That's the one that we're going to be driving with. And Dennis Smith is going to moderate two just well-renowned subject matter experts on this contact tracing piece. So don't forget to start with your questions. There is your question icon by which you can submit questions. And we have posted the rest of the 9 webinars on our website. And so you can always go back to see them. And guess what? If we don't get to your question today, we will address those questions and afterwards we will post them. And so we also have Karen Price Ward, one of my favorite people in the whole wide world, from Southwest Airlines, because we told you we're honest people. We're going to give away some Southwest Airline tickets, and then we're going to have an open chat at the end where you can ask anyone any questions, even Karen if you want to. But let's begin by just telling you who we have on the screen here. Dennis, kind of raise your hand. He is the director of the MBDA Business Center, Capital Region of Washington, D.C. But the MBDA Business Center is part of the U.S. Department of Commerce grant that we did receive, and it's over nearly 40 business centers from around the country. And it's, again, funded by the Minority Business Development Agency, U.S. Department of Commerce. And Mr. Smith has extensive experience in establishing and implementing policies and programs to maximize small and minority business participation in acquisition of goods and services and government and commercial needs. Prior to this role, he has served as Deputy and Director of Prince George's County Minority Business Programs, and his resume would choke a horse. We don't have time, so we're going to move on to the next person. We have an old friend of mine, Herb. Give us a nod or wave a hand. He is currently the Chief Information Officer in the Office of Enterprise Technology for the Maryland Department of Health. That makes him sound real important and smart. But along with that, he has a responsibility for enterprise-wide strategic plan, management, and the execution of governance for Maryland Health Resources. And in talking to Herb, there's a lot going on, particularly now with the pandemic, and the Maryland Department of Health being a leader in the state of Maryland for all things considered. Prior to this role, another person whose resume would choke a horse, but he served as in the state of Maryland as the Deputy Secretary for the Governor's Office of Small Minority and Women-Owned Business. I know a lot of you remember him from there, and he comes with over 20 years of transformational leadership experience in management and information technology. Thank you, Herb, for being here. I got a new friend today. His name is Jeff Stover, Executive Program Advisor in the Office of the Commissioner at the Virginia Department of Health, VDH. Hi, Jeff. How are you this morning? And we appreciate your presence here today. He serves, as I said, as Executive Director, Executive Program Advisor in the Office of Commission at the Virginia Department of Health for the past 4 to 5 months. He has helped to lead the creation of Virginia's exposure notification app, COVID-Wise. And as I understand, one of the first in the country. Cannot wait to get this information. He's a former board chair for the National Coalition of STD Directors, and he participates on other organizational committees to include the Virginia University Public Health Advisory Group. Prior to his role with Virginia Department of Health, he helped coordinate female reproductive and occupational health research studies at the University of Alabama, Birmingham. But in talking to him today, he loves Richmond, and we're glad he is in Virginia. And then last, but of course, never least, is my good friend, Karen Price Ward, Community Outreach National Strategic Relationship Lead for Southwest Airlines. I can't believe I said that all in one sentence, but she is very important because she serves as that, and I'll say it again, Community Outreach National Strategic Relationship Lead for Southwest for 25 years of experience working with over nearly 100 strategic partners. And we are proud that Southwest Airlines is our official airline and we are a strategic partner. She's highly skilled, a special project manager with program content development, management, communication, strategies, positioning, negotiating, planning, engaging internal and external audience and partnering with cross-functional teams. And we are glad Karen is here today. And so we just wanted to upfront tell you who's here, who they are, and why you should listen. I'll ask them to leave the screen, all but Dennis, so I can chat with him a moment before we just turn it over. Dennis, thank you so much for having the vision around bringing this together, you and your team with Ken Clark and Latoya. And we, of course, have to thank the our COVID team, which includes Sonia Bigelow-Smith as its project director and Nicole Miles, but the whole consortium about what we've been doing since March. Contact tracing, I think it's a community service that we're having this conversation today. And with that, I'll turn it over to you, Dennis. Thanks. I'll be back later. Dennis?
Thank you, Sharon, for your leadership and support. Good morning, all. The MBDA Business Centers assist minority businesses with identifying contracts and building relationships to foster business opportunities. Additionally, we try to assist with finding financial support. We have a flyer in the downloads you can access for more MBDA Business Center information. Thank you for joining us today. As Sharon pointed out, the elephant in the room today is COVID-19. We have come to recognize that it's not an either-or question of containing the virus or opening the economy. It's just one question. How do we as a community, as a state, and as a nation come to feel safe and healthy enough to go outdoors and proceed with what we used to call our normal way of life? We in the DMV have been blessed to have leadership that have guided our infection rate low enough that we can proceed to the second phase of addressing this monster. We can home in on an outbreak of COVID-19 by instituting a method referred to as contact tracing and tracking. We have two experts here today that will help us understand this process. They may help you in terms of understanding this process so intensely that we, in fact, will be presenting and bringing you information today that will be so very important. We will inform many of you about the next steps, but we will also provide some of you maybe some business opportunities. In order to have a safe and healthy workplace environment and a safe and healthy community, we will do this with these two expert panelists, Herb Jordan. Our first panelist will be Herb Jordan, and as Sharon introduced Herb from the state of Maryland, I would like for Herb to join us right now. Herb, tell us a little about your position in the state of Maryland and why you assumed this massive undertaking.
Thank you, Dennis. Thank you for the introduction, and I appreciate Sharon Pender, my old friend. It's good to get the band back together. I love that picture. I think I was 16 in that picture. But I want to thank this. Basically, I was called to do this, I guess, about 3 years ago. Secretary Bobby Neal of the Maryland Department of Health and Dennis Schrader, who was then his chief operating officer, as my boss, were basically interested in trying to improve healthcare outcomes for Marylanders through reinventing the basically Department of Health in so many different ways. And it was a chance for me. My mother was a community organizer, and so I've always had this penchant for public service and doing good. I've been in the private sector most of my career, done a lot on the large enterprise systems, management, commercial sales, insurance and banking. But to be in the health department is just incredibly, to be around a passionate group of people that want to solve problems. And then, little did any of us know, a couple of years later, we'd have a pandemic, and guess what? The health department becomes the governor's tip of the spear in terms of the response after that. So we started off turning around the health department. In that sense, Office of Enterprise Technology has just come tremendously. I was brought in as the department's first enterprise CIO. So we had, let's say, I had 35% of IT when I got started. And now we've brought in Medicaid, we brought in phone systems, 11 hospitals, on and on and on. About 75 or 80% of IT now is within IBL, not as centralization, but it's getting better outcomes through shared services. And so we've added things like cybersecurity, enterprise architecture teams, organizational change management, portfolio management. Lots of changes have occurred to, once again, get better healthcare outcomes. So in the midst of all that, then of course we get a pandemic. And so all of us in the health department went from having several full-time jobs to having yet another one, which was to deal with this pandemic. And so in less than, I think it was less than 2 weeks, we had several thousand people teleworking and had that working pretty effectively with a few bumps. Then on top of that, my boss, who was the chief operating officer, Dennis Schrader, was detailed to the governor's office to handle the surge hospital construction. And now he's handling testing. And so he's called upon me. And so as a part of that, we're now taking over, our department, taking over the COVID link, which is our contact tracing solution, as well as the test sites. We have 15 state test sites that are going on. And all this is tied together. As we get through this presentation, we're going to talk about that some more. But I'm a guy who likes the challenge. Either I love things that are horribly broken or that need to be work much better than they're currently working. It doesn't get much better than this in a pandemic and at the health department. So it's been a great ride.
Oh, great. Right. So tell us about the contact tracing and where Maryland is right now with contact tracing.
Okay. You guys bear with me. And, at the health department, as an Indian business, I was an entrepreneur for many years. You always have to be ready for changes and transformation. I started this presentation off in my office, my wife's office. We had some construction going on. I live in a high rise, and now I'm at my third PC this morning, and I'm in my kitchen. So bear with me. And there's still construction going on. I hope you guys don't hear it in the background. And so bear with me. Quickly, contact tracing. There's 4 big goals, and so I'm going to try to give you the 4. If I had to strategically lay it out, what is in contact tracing? Basically, if I had to put it in a couple of sentences, it's basically a resulting of positives in a pandemic situation. You have testing for a certain, in this case, it's COVID-19. You get a result, then contact tracing kicks off. So basically, there's 4 strategic goals in contact tracing. One is we want to decrease the transmission of infectious diseases. In this case, it's COVID-19. That's step 1. And today you're going to hear about from Jeff Stover from Virginia. You're going to hear about a product, COVID-Wise, which really is about that. Okay. The second big goal is ensuring cases and contacts have access to services to kind of navigate, isolate, and quarantine. There's a product the state has called COVID Connect, which basically provides a foundation, a framework for people who are tested positive to connect with resources, the community, to share their testimonies, and help them get access to the things they need to heal and get back up on their feet. That's COVID Connect. But most of what people traditionally think of as contact tracing has to do with solutions in the area of increasing the proportion of cases and contacts with outreach that have happened within the last 24 hours. So someone's been diagnosed positive. How do we deal with that as quickly as possible to avoid that person from infecting others, right? And so that's number one. The second part is to complete the proportion of cases that have gone through some interview process, because contact tracing is really about an interview. We first started this process out, the average interview was taking about 40 minutes, right? And so the product we use in those two areas really is called COVID Link. And that's our core product that we use to handle that. It's really a CRM. It's a customer relationship management tool to be able to track these cases, these interviews, and what goes forward and handle the positive such that we can, as quickly as possible, let people know, and then they can let people know, and we can track it, and that way slow the spread of the virus by getting them to take the proper steps early on in the process.
Okay. Ken and Sonia, they're out there with some questions, and I want to make sure that we get some of these questions in. Ken and Sonia, please provide me some questions that you have for Herb.
Yes, so thank you, Dennis. And just will also say as we begin to take questions, if you have a question, please put it in the question box on your screen. We'll try to get to as many of them as possible this morning. And if not, they will be addressed after this webinar. Herb, there is a question around being that we've hit 170,000 deaths associated with COVID with a steady rise with children. What is exposure notification compared to contact tracing? And what are the benefits to our broader communities relative to virus control?
Oh, great. That's a great question. So when Steve Stover, when Jeff Stover joins us, he's going to talk about exposure notification. Exposure notification is basically, let's back up, contact tracing when someone's been diagnosed positively. Okay, you've been diagnosed positively, then contact tracing kicks in. Exposure notification says, okay, I am someone who's been in around someone who has been diagnosed as positive. And so it's kind of notifying that person to see if they should quarantine or which steps should they take, because they've been around someone. Typically means the CDC standard is 15 to 30 minutes of exposure. That kind of thing creates the possibility of you having the virus. And so as a result, that exposure notification is an important part of being proactive. I mentioned early on, decreasing the transmission of infectious disease. If you can tell me I've been around somebody positive, I can do some things to make sure I don't spread it to anyone else. So that's exposure notification. Contact tracing is I have a diagnosis of positive, and that's where that starts.
Herb, it's Ken Clark. One of the biggest questions that we've seen among questions from our listeners is, what are the business opportunities? How can more people get involved? How can our minority businesses get involved in supporting the state in contact tracing activities? Is there staffing issues? Are there other technologies? How can we get involved?
So Ken, that's a great question in terms of opportunities. Let me break it up into two parts. The first part is, what is the opportunity from a business perspective? And then the second part of it is, especially if you're in government, how do I get access to that? What's the procurement process to get me access to that? So let me start off with the good news, which is the opportunity. We'll get to the bad news or less good news. On the opportunity side, there's a lot going on there. When I look at contact tracing right now, I mean, the state has gotten, we've probably, our budget right now is probably, I'm thinking $60 million at least just for the solution. But I'm also thinking we received at least, several billion dollars in the federal government. Some of that's been distributed to local health departments. And so what's happened is you have a big need for these interviews that I mentioned. There's a state solution and there's local health departments. Local health departments are engaged at the local level, the 24 local jurisdictions. So they, in some cases, they were the first responders. They were the first ones to do contact tracing. They stood up their own independent solutions to do that. The state came in later on because we had to have a more enterprise solution, and we engaged as our call center, an organization named NORC out of Chicago. That's about a $35 million contract to basically do those interviews, which, like I said, we're averaging about 40 minutes. I think now we're down to about, I've seen it down to about 16 minutes. Do those, and this is some very complicated workflow to do that. And in that case, once you have that firm, that's a call center. There's lots of these so-called contact tracers. They staff these call centers, and different states have handled it different ways. But these local jurisdictions also have these people. So this is training to do those lengthy interviews to begin to figure out who that positive person has, who they've been in contact with. So there's lots of opportunities there. At one point, I heard that Baltimore City was looking at hiring about 500 contact tracers. I know the call center that we've contracted with is geared to scale to as many as the state can handle. That's what the contract is, the size that it is. But the opportunities are in the contract tracers itself. That's a staffing opportunity because some states have totally outsourced that and staff that independently. Local jurisdictions are doing the same. The opportunity is in the software. There's kind of two phases of this. The first phase of this was obviously it happened, and we had to very quickly stand up software that went from people getting registered and tested all the way through to, okay, I've tested positive and I tested negative. How do I communicate that information, right? So the opportunity there was to create that software, and that software is basically it's customer relationship management software. In our case, that's technology stack has involved Salesforce development. It's involved Microsoft and a host of other vendors, which we can get into a little later on. But the opportunities have been there for the software development. It's been for that. It's been for the logistics and supply management. Obviously, every single one of these there's a lot of resources involved. How do I manage those resources? But contract tracing specifically mainly is about the staffing, and it's about the software. It's about reporting and analytics on the back end. I've actually got, when you guys are going to have at some point, there's a handout that I made available that at the end, and that kind of lists all those content, those areas. A lot of texting support is needed because people need a portal to come to get the results, or you can text the results as opposed to having a call from sometimes not their doctor, but from whatever source they got the testing from. Because remember, this whole thing started out, testing was done by your doctors initially. Now we have these state test sites. And so there, you don't need an appointment, just show up. You don't need a doctor's order anymore. That's changed the whole game. So there's the whole management around reporting that information out. So there's certain web portals necessary for that and texting. And then there's the whole concept of once again on the back end with the providers and the ordering and the kits. That's an opportunity. And then reporting and analytics. Obviously, all this is about at some level looking at this from a local jurisdiction, a state level, and trying to figure out how do I turn the state back on, and how do I do that in a way that least impactful of business, but once again reduces infection, spread of infection. So all those are kind of broad areas of opportunity. Now, on the procurement side, how do I get access to that? When things jumped off initially, you had to get it done. You had to get it done yesterday. There was not, and you probably noticed the business community noticed there were not a lot of procurement opportunities you saw right off the bat. We had to go to existing contracts and get things done. We had to go to emergency procurements. So we used vendors that were already available to us, contract vehicles we already had because we had to do it quickly. Now, just recently, like I mentioned, we've just started this. I just organized a group working with Dennis Schrader, who's now, like I said, managing testing for the state, to put together a new group for us that's now going to step back and say, now that we put all these Band-Aids in place from testing through contact tracing, how do we then look at this strategically and begin to figure out how do we put this in place for the long haul? Because obviously this has been 5 months now. This wasn't a 1 month and out. It's now something we have to plan for the next year, 2 years, 3 years. So now we're stepping back to see what did we do, how can we do it better? I think you're going to see a lot of opportunities coming up as we go through more normal procurement process and start to put in place the solutions that not only going to be for this solution, right, but also for the fact that whatever the next pandemic is, as everyone knows that's going to happen again. So how do we take these tools and make them generic tools the health department can put on the shelf and then reach back out and use for whatever comes next?
Okay. Thank you. Thank you. That's a mouthful. That's right. That's right. And we have our next panelist that we're going to bring on, Mr. Jeff Stover. Jeff is from the state of Virginia. Jeff, we've been told by in your introduction that the state of Virginia is out front on this contact tracing. We're not surprised. You have a governor who's a medical doctor, so we expect that out of the state of Virginia. So Jeff, tell us a little bit about why you and the state of Virginia is a little bit about yourself and why the state of Virginia is out front on this.
Yeah, sure. Thanks, Dennis. I appreciate you guys having me. So we are pleased that we were out front. We were the first state to launch an exposure notification app in the United States, and there's been 3 more since then. But it wasn't a race. We just happened to be on top of this specific issue when we started, and we started an evaluation process very early on. We knew that this was going to be another tool to put in the toolbox for prevention activities. It's not a silver bullet by any means, but we knew it was something that could help. So we started doing evaluations of vendors, months ago, while Google and Apple were still working on their exposure notification framework, which is what our app is based on. So by the time they did that and they released it in around the 20th of May or so, we were ready to go. We had made a vendor selection and we were already well on the way of contract negotiations. So we really got started in app development pretty much as quickly as we potentially could have based on the framework that had been put out by Apple and Google. That really helped us to get out there in the forefront. And, fortunately, we were able to get going there in early August. It was the 5th when we actually launched, and, start to really work on getting citizens of the Commonwealth and even people who are in close areas outside our borders to really start paying attention and download this thing to help themselves.
And Jeff, what are the possible business opportunities that may surface as a result?
Yeah, well, I think public health has not ventured into the world of app development very much. Now we have, right? We've jumped in with both feet when it comes to COVID here with exposure notification. But I also think it's an opportunity for public health as a field to say, this is a means of technology that we can take advantage of, and from a public health perspective. So I think app development from a technology perspective is something that we can definitely do. Herb was talking about the call centers, et cetera. I think, temporary contract agencies that are making use of minority populations can be extremely beneficial. Public health, as we all know, is rooted in trying to reach populations of need. And it's unfortunate that is largely minority populations, but that is what it is at the moment. And in order to really tackle that, right, we have to have ways that we can reach those people and have those people in those specific geographic areas trust us. And trust is a big issue. We're trying hard to push that from this app perspective, but we have to have ways that we can do that and get our societies across the board from every corner of our state and every other state to trust that what we're doing is not, government intervention per se. We're not tracking things. We're not tracking data for the sake of tracking data. We're actually putting things in place to improve the health of populations.
In that instance, Jeff, you're going to have to have a large contingent of labor in many instances to reach the populations that you want to reach.
Right.
So it's labor intense as well as it is technologically intense.
Absolutely. Yeah, absolutely, Dennis. And I think part of the technology solutions from a contract tracing standpoint, it's not an easy thing. We all know from the world of our smartphones these days that when you get a random phone call, you probably don't answer it, right? Someone that's not in your contact list, that's just a random number, you're probably letting that go to voicemail because you know that 30-40% of them are robocalls and you just don't want to deal with them, right? So that's an issue for us from a contract tracing standpoint, right? So there's plenty of technology opportunities there, I think, and there are people in this space already, but I think there's room for it to grow, where developing technologies and honing those that allow us to reach people via text message, et cetera, in ways that can get buy-in from the individual so that we can increase the proportion of those people who are getting back to us if they're not answering their phones, right?
Yes.
So I think that's another opportunity for us.
Yes, I can imagine something coming up saying, you have been exposed. Mm-hmm. That would be an alert.
Right.
Yeah, right. So Jeff, we want to take some questions.
Sure.
Sonia, Ken, any questions?
Yes, we do. We have some great questions coming in from our audience. The first one is, Jeff, if you could just speak to the success of the COVID-Wise app. How many people have downloaded the app, and what are the measures that are being taken to really prevent the unauthorized allocation and solicitation of the information that's being gathered?
Sure. So thank you for that question. So as of last night, we try to measure our data on a daily basis based on midnight the day before so that our data is consistent across the board. We're a little over 376,000 people who've now downloaded COVID-Wise in a little less than 2 weeks. So we're excited about that. That's about 8.8% of our market population based on smartphone users in Virginia. So we're really excited about that, hoping to get to 10% here pretty quickly, but 376,000 is pretty good for us. So that's how many people have downloaded so far. From the standpoint of what data is being collected, we designed this app specifically for privacy and confidentiality. That is at the heart of what this app is all about. And we are 100% transparent about that. There's nothing about this app that collects any location-specific data, GPS-related data, etc., or personally identifiable information. We don't know your name. We don't know your social security number or any of those things in this app itself. It's not needed for it to work, and we made the conscientious decision to say if we don't need it, then we're not going to collect it, right? Our point here is not data collection, it's improving the health and safety of our population.
Okay. All right, Jeff, what we're going to do now is to bring on the entire, bring back on Herb and the entire panel. And we're going to field some questions from the audience. All right.
Okay, we have a number of minority businesses who are greatly creative, and they all have ideas on how to address contact tracing. How can people get their ideas before the state of Maryland and the state of Virginia? First, Herb, and then Jeff.
Oh, that's a good question. I mean, if you can imagine, I guess I'm probably, I don't know, probably averaging 150, 200 emails a day, and everyone wants to get in front of me. So that's a great question. I would think the first thing is first of all, you got to know what you're talking about and come prepared. There are a lot of people at the table right now, so I mean, do your homework. I mean, right now, for example, key concepts. We have something called, I think Jeff was talking about it. Trust is such an important factor here. So as we've gone down this journey of contact tracing with testing, we've partnered with CRISP. CRISP is our health information exchange that we use. I know we use them here. I think they're also used in Virginia, not Virginia, West Virginia, and also in DC. I'm not sure about Virginia, but we've got one of the better ones in CRISP. And the reason I mention them is here's an organization with the health information exchange. Every state has one. Was created because individual citizens don't trust government with their HIPAA, their PHI, their public health information. And so this organization was created to kind of be the manager of our health information. But if we partner with them, they've got access to all the providers in their system already. They've got access to a number of us in their system already because we have medical records. And so partnering with them is a huge leap forward. And so we've used them as kind of our system integrator, and we've worked through them. So they're a key partner. If you've got ideas, not just the health department, but the health information exchanges, probably in most states, if you have a good one, are going to be a good source because once again, otherwise the states that didn't start with health information exchanges, they all had to start off by having people rekey provider information, rekey basic data about individuals. We start off with information already because we partner with them. So I'm saying come with a solution better than everybody else's. Just like Jeff from Virginia, we started off taking a hard look at what's happening in other states, who the vendors were, what the solutions were, such that once again, we didn't have time to make the mistakes someone else had already made. We only had time for new mistakes. So we started out that way. So once again, come with the knowledge of whatever what your solution is, your innovation is, how is that working in other places? How is it better than what else is going on? And if you can come that way, that's going to get our attention versus, starting from square one with a solution that we already have in place. To Jeff's point, a lot of the state is not in development. That's not what we do. We don't want to do DDI. However, in this case, we've had to do a lot of work with contractors, and now it's time to put in place COTS products and move on from that. We are definitely open to talking to the vendors. I'd say right now that the good starting point was make sure you have your act together in terms of what that solution is. And if you can speak the language, you'll get our attention relative to once again, your positioning relative to other solutions that are out there right now, be it staffing or software or systems or technology stack, et cetera.
Okay, Jeff.
Yeah. So just to piggyback on Herb, I think he's exactly right. In Virginia, if you're not registered as a SWAM vendor, which is an acronym for Small Minority and Women-Owned Businesses, you can do that. We actually have a Department of Small Business and Supplier Diversity in Virginia. You can go there, and there's a registration process to become a SWAM vendor. That's a first step, in many respects to do that, because SWAM vendors do get they'll get some preferential treatment, right? Because we want to do business with small minority and women-owned businesses, in addition to others. But that's something that's definitely that I think folks can do if they're not already doing that and registered as SWAM in Virginia. And I think you can go through the Department of General Services as well, through their procurement folks. They have lists of people at the moment from a COVID standpoint. I'm sure Herb got these too. We were inundated with emails from vendors of every shape and size, especially in the early days of COVID. Everybody, telling you how they can supply you with anything you can imagine. And they were put in lists, right? We created lists of all these types of vendors. And I can assure you, those will become useful as we go forward. Hopefully we're not going to have another COVID pandemic anytime sure, but we have pretty big public health events every 2 to 3 years these days. You think SARS and MRSA and H1N1 and Ebola and COVID, right? The list goes on. I don't see that letting up. Hopefully we won't have as big an issue as this, but I would imagine we're going to be going to those kind of lists going forward when we have future events and, saying, okay, who are the vendors who supply X, Y, and Z, right? Who are the people that let us know they were there before? So I think it'd be very good if you feel like you've got something to offer, then, making contacts, but I think doing it in a way that looks like you know what you're talking about and you've done your homework would be very important.
Yeah, just let me.
Thanks for mentioning SWAM, which is run by Tracy Giudiwali, who was a former president of this council and a good friend of many of us up here. And Karen, contact tracing is something that I think would be of interest to the airlines, knowing what's going on with people who are boarding your planes. Have you given any thought to this whole area of contact tracing?
I believe that we are constantly looking at innovation because that's going to be so critical to help with this global pandemic. So certainly we're keeping the lines open, but I don't know of any immediate, implementation at this time. Of course, we're relying on the experts, and I think once the experts are able to really, truly figure it out, then certainly I would think that the door would be open. But from our leadership, I have not necessarily heard exactly that we're using that. Right now, there are a number of other measures that we are enforcing, just like everyone else, through the CDC and World Health Organization.
Okay, Jeff, we have not heard exactly how does COVID-WISE work? I mean, what is the secret sauce of COVID-WISE, and what other technologies did you look at?
Yeah, sure. So I'll start with what we looked at, and that was, any vendor that came forward. We probably had about 12, 15 vendors that we evaluated. And some of them were coming to the table with apps that they were developing early on that's focused on GPS technology, right? And a lot of times those were vendors who were marketers, right? Marketers for big corporations who have Bluetooth, sitting in their big department stores so that they knew when you came in, like where you were, et cetera. So that's Bluetooth helping with location because of where it's situated. But it was largely a GPS related thing. We decided not to do that. There were a couple of states that tried GPS related apps. They didn't fare that well in the grand scheme of uptake amongst citizens. And some countries had done the same thing. I think most people have migrated to more of this model of what Google and Apple put together, which is what we did. So what is that? And that's the Google Apple Exposure Notification System. Okay, so those two tech giants worked very closely together, and they're still doing it today, to develop a skeleton for a system of exposure notification that public health authorities around the country can use to build apps. So they're not building apps. They didn't build it for us. They're not in the business of doing that where this is concerned. What they were in the business of doing was providing a skeleton, configuration files that we can then use to help inform citizens around the Commonwealth. And that happens through Bluetooth Low Energy, right? So it's BLE, and so everything is happening through Bluetooth signals. So just like your speaker, if you think about the speaker you have in your bedroom or the Bluetooth speaker that might be in your car, your phone is paired with those speakers, right? And if you're farther away, it doesn't work as well, right? But we've all probably been in a situation where you walked by a car, your car, and all of a sudden your phone conversation got picked up by your car, right? Because you were close enough that that kind of thing is happening. And that's the same kind of principle that's happening here. So those Bluetooth signals are based on strength of signal, and that's how we can approximate distance. So if you're within about 6 feet of each other, so you have 2 app users who are using this, those Bluetooth signals are being shared. They're random signals, they're not tied to you. So it can tell by the strength of the signal if you're within about 6 feet, and it also knows how long you've been within that distance. So we can measure if you've done that for at least 15 minutes and you've been within 6 feet during that time, and it's happened within the last 14 days, meaning of when that diagnosis date of someone else was, then it's going to flag that as a potential exposure. And then that other person who may have been exposed to, say me, if I was the one who was positive, then they would get a notification exposure via that app that lets them know that it was a likely exposure, and then they can take necessary steps.
All right. Thank you. Thank you, Jeff. Ken, hopefully that right there kind of answered that question. Herb, did you have any comment?
Yeah, Dennis, I want to return to procurement for a minute because I had my state hat on, and I want to think like business people think. All right, I want to put that hat back on for a minute. Let me just be real specific in terms of where the procurement opportunities are and how I get access to them. Clearly, my friend Jeff reminded me that Virginia is always ranked in the top 2 best procuring governments in the country, and Maryland historically has been ranked at the bottom 3. And to solve that problem, when the governor started the Procurement Modernization Commission, I was a part of that, and we hired away actually the chief procurement officer of Virginia, who'd been there for 10 years, to come over and help with Maryland. But in the midst of a pandemic, it changes all the rules of engagement. And so things like the CATS contract in Maryland, that's going to take me, whatever I do through that contract is going to take me 6 months to a year. So that's going to be something that's low on my list to do. So what are the tools that I'm going to try to use? We're going to use a lot more of national contracts like NASPO. We've heard of NASPO. NASPO is a consortium. States get together, they bid on things, the prices is achieved, and then we can buy it off that contract directly with a quicker process. NASPO, those kind of contracts are very important. The last Board of Public Works meeting I met with, I spoke at, Lieutenant Governor, one question he was asking was, why aren't we using the IT 70, the GSA 70? Why are we using that IT 70? Why are we using that schedule? That's been a lot of hurdles, but we're going to working on right now how to begin to use that to speed up procurements. And the last thing I would say is there are a lot of master contracts in place right now, especially with the DOIT, the state IT department. Those master contracts are a lot quicker vehicles than many other tools that we'd use, like, once again, going to something like CATS. That would be much, much faster. And then, of course, if I can shop those master contracts, lots of them already have primes, that's where I find MBE subcontracting opportunities through those primes that are on those master contracts, because those guys are getting lots of work right now. And then I would wrap it up by saying the Small Business Reserve is a key place to go. I think when I started with the Hogan administration, the governor really wanted to make that a much more viable program, and we've done a lot to make that way more effective than it's ever been. And there's lots of opportunities. A lot of things are put out now. First is SBRs. We don't get hits. We put it back on it without being a Small Business Reserve thing. So get registered with a Small Business Reserve for sure. But shop those master contracts that do it, and at each of the agencies to have their own, because that's a quick way to get procurements done. That's where a lot of us are turning. We have to get things done quickly. And that'll change once the pressure's off. But right now, we're still in a get it done very quickly.
Okay. Thank you, Herb. And we'd like to bring Sharon back on. Ms. Pender will be shortly joining us. And
while Sharon's coming on, Karen, a lot of people are nervous about flying these days, and all that close contact that's not being traced. What is the airline doing to make flying comfortable, easy, and healthy?
Yes, and I'll be sharing a little bit more about this, but we have made the commitment that Southwest Airlines will not sell the middle seat, at least until October 31st. We also have put in place distancing with our boarding procedures, so we're boarding only 10 at a time, and a lot of other measures that I'll discuss as we close out.
Dennis, I think we still have a couple. We still have time for a few more questions. I hate breaking up the groove. You know what I mean?
Mm-hmm. Okay.
Do we have any more questions?
Anna, Sonia, any more questions?
Yes, we do. There is a question for Karen again. Karen, as business travel is picking up and we've moved into reopening, can you talk a little bit about what people can do with their travel funds? Are they being protected? Any updates in terms of how to use those later on?
Yes, so we are monitoring, and in many cases we are doing extensions. So I would certainly encourage you to make sure that you are checking our website, because as it comes close to perhaps your time of travel, and if people may be feeling uncomfortable, we have been doing some extensions. So please make sure you're keeping abreast of our website.
One of the issues of using apps is that if they were more universally available, more people, particularly here in the Washington metropolitan area. Herb, is Maryland looking at COVID-wise, or what other technologies is Herb using, is state using?
That's a good question, Ken. We started some time ago, like Virginia did, speaking to Google and Apple way back, I guess before they had an offering. And now we have had some, Jeff let me know, we've had some conversations. I followed with some of those people already talking about COVID-wise. We would love to take advantage of what other states have already done rather than try to start something from scratch. And we clearly could use it. We don't have an exposure notification application. It's on our roadmap. So we're definitely looking into that right now. As we talk about this, one thing I know we mentioned earlier, just in terms of a key skill set, just want to think about is, remember, everything that we do here has public health information involved. So once again, from a security perspective, any business trying to get engaged here has really got to understand what that means in terms of protecting data, either if it's on paper or it's electronic, but really understanding what that looks like. That's critically important because, once again, public health information, people's records, this kind of information we're talking about is stuff that has a lot of rules associated with it, and you have to understand those rules to be successful. So.
Okay, any additional questions?
Yes, there is an additional question. This is directed to Herb or Jeff. There's a question around, what are your thoughts around the rapid tests that has been received for the emergency use authorization from the FDA? Any thoughts?
Yeah. Well, that's with Jeff. Well, I'll just say quickly. I know we've been looking at. It's called on the deck that I have that you guys have as a handout. It mentions this, and it's called. The name is eluding me right now, but it's kind of point of care. That's what it's called. We have these small machines in doctors' offices, and you can get a test, and again, you get a COVID test. The problem has been the whole concept. You go to the state's website, coronavirus.maryland.gov, coronavirus.maryland.gov, and you see all the statistics. All that data comes about because everyone who gets a test gets their test through one of our big labs, right? University of Maryland has a lab, Quest, the LabCorp, a bunch of smaller labs. Because you go through that, it gets into CRISP, and we can then report on it. Well, now these small point of sale devices, which a lot of physicians have, the FDA has approved those now. The problem is those machines are not connected into our reporting structures at all. The data does not go to CRISP, et cetera. So now that's happened, obviously we're encouraging it. And in Maryland, we stood up a Band-Aid for right now is, since every physician has access to the CRISP system, they're required to go in when you do your point of contact test, to go into CRISP and register that. And so then it ends up going through our normal process. And there's something called NEDS. NEDS is the disease reporting system the CDC requires. Every state has one, but that's where all the testing results come from. And then from there, it gets disseminated to wherever it needs to go. And then NEDS feeds CRISP, and CRISP feeds contact tracing. But it's, yeah, that's kind of the workflow that's important.
Okay.
And I would simply add to that Maryland and Virginia are both part of a multi-state collaborative looking at antigen testing, trying to use our collective bargaining chips, if you will, to ensure that we get manufacturers putting these kind of tests together quickly so we can get them out to folks. But it's also moving very rapidly. Just since that multi-state collaborative was announced, we've had the announcement just a couple of days ago where the MBA worked with Yale, and Yale's come out with a rapid test that Saliva-based test that wouldn't even require these big machines, and the FDA approved that very quickly. So it's going to be an ongoing race that I think we're going to be playing catch up constantly, right, with the testing technology that's available and how we can go about trying to get that to the most people possible.
And I would also say the business opportunity here is that a lot of these point of care machines I was talking about, none of them are connected to anything at this point. They're all standalone devices. if someone could figure out a way to get those connected so they could once again be able to feed the hospital EHR systems or feed CRISP or whatever, that would be very, very helpful, as opposed to right now it's independent keying into that information, because none of those machines right now are connected to anything.
I understand that Johns Hopkins has an extensive contact tracing course. Are you recommending people to use that course as a basis for staffing and getting people involved in contact tracing?
I don't know a lot about that course, but I think that course is preparing the actual contact tracers themselves. I know there is a certification process, and I'm sure maybe that's what Johns Hopkins is doing. But I tell you, that is a very specific skill set that requires training. So clearly you need to have the training and the certification to do it. It's not, it may sound simple, but it's not simple at all. I think on my deck I might have left it out, but we have a workflow of the call comes in and here's all the branches it can take. It'll give you a headache just looking at it. And so it definitely requires some training.
Yeah, and I would add to that you know, contact tracing is a defined skill set. And you know, there are various entities. Yeah, Johns Hopkins has some. You know, the National Coalition of STD Directors has some. The Denver Public Health Training folks. But you know, contact tracing is not new. Okay? It's been around for many, many years in the world of sexually transmitted disease prevention. Right? Those are the original contact tracers, and they still do that on a daily basis, every day, all across the country. And they've been used extensively. So people who are interested in contact tracing, you know, there's also trainings associated with what those folks do. They're really called disease intervention specialists. And we refer to contact tracing today since COVID's kind of taken over that environment, and understandably so. So DIS, or disease intervention specialists, have been used for years. We pull them in when we have outbreaks of all sorts of things. You have a TB outbreak in a specific city. Oftentimes DIS, who are already part of that public health workforce, get pulled into that. And you know, I think we can look back at those folks, see what kind of training has been put in place for them over the years, and use it to help you know, pull in even additional resources to a field that I think is going to be needed for quite some time.
Hey, Jeff, I'm sorry.
Oh, go ahead, Herb. Go ahead.
I was going to add to that, Jeff. You're right. It existed for sexually transmitted diseases, SARS, Ebola. It's just a scale. Like SARS was 3,000 worldwide. We're looking at 100,000 positive COVID-19 cases in Maryland alone. So it's the sheer volume and scale here which changes the solution that existed for those earlier infectious disease issues.
You know, this
Herb
is
and Jeff, I want to thank you all. Sharon, any comments?
Yeah, I was actually gonna say the same thing, Dennis. I was saying this has been a real, back in the day, we'd say this has been a real deep conversation. I'd like to take a commercial break right now and perhaps come back if we have time at the end. But Dennis, you're about to say the thank you, but I wanted to, before we run out of time in the hour, be able to do our giveaway from our favorite airline in the whole wide world. And so as we wrap, again, if we have any time, we'd like to come back, but my goodness, this has been a rich conversation. And thank you to the question whisperers who are asked the question on behalf of our audience. But awesome conversation. And we appreciate you sharing your gifts. You know, we hear a lot about this fight on the pandemic, but we don't, and we talk about and our gratitude toward those on the front line. In a sense, you guys are on the front line in a different kind of way. And so we thank you for the work that you're doing, because it's all going towards solving probably the biggest problem of our lifetime. So thank you.
Thank you, Sharon.
I'm booting everybody off with Karen, and we're going to do the airline ticket, then we'll be back. All right?
All right. Thank you very much, Sharon, and thank you to our audience. Just to elaborate a little bit more on some of the questions that were asked today, as it relates to travel funds, please know that Southwest Airlines has never had change fees. So if you do feel the need to change your flight, there's no cost to you. So only the difference that you may pay in that flight. So please, again, check our website. And then I'd like to share with you some more about what we are doing from the standpoint of safety. So we do want to let you know that safety is our top priority and your well-being is our top priority. And we have really tried to employ stringent cleaning and physical distancing practices to support the well-being of our employees and our customers. So we are using electrostatic disinfectant and an antibacterial or antimicrobial spray. They're applied on every surface of the aircraft. They are killing viruses on contact, and they're forming an antimicrobial coating, or if you will, a shield for 30 days. We're also using a broad spectrum disinfectant. We use it to clean on board the lavatories and the tray tables, and we do that before every flight. And we're also going to deep clean each plane from nose to tail every 6 to 7 hours every night. And we started doing that back in March. Our aircraft is equipped with sophisticated air circulation systems that introduce fresh air into the cabin every second while in flight, and resulting in complete exchange of cabin air 2 to 3 minutes. And we're using HEPA filters on board that remove 99.97% of airborne particles. We're also supplying hand sanitizer. It's available at check-in at the kiosks, our ticket counters, as well as the gates. And we do have wipes that are available for all of our customers. And we are cleaning our ticket counters, our gates, and our baggage claims multiple times during the day. So we do want to, again, make you aware that we are not selling our middle seat, at least until October 31st. We're boarding in groups of 10. We're supplying masks to our employees. And if you as a customer needs one, we have one for you. So when you are ready to travel, please know that Southwest Airlines will be ready for you. And we thank you for considering Southwest Airlines. And now, without further delay, I believe that I am going to share with you our lucky winner. So let me just make sure that I have that information. I'm not sure if Sharon or Sonia might have drawn the lucky winner.
Thank you, Karen. Yes, we do have a winner. And Sharon, I'll let you, if you want to continue on, you have the
Sonia.
Okay, great.
And Sonia, before you do that, because you have to be present to win, and so we will release the microphone because we got Shauna is from Graybo, who is our wizard behind the curtain, that will open up the mic so that person can accept. But you have to be here. Go ahead, Sonia.
Have to be present to win. So drum roll, please. The Southwest winner, the winner for the round trip ticket is number 48. 48 represents the National Minority Supplier Development Council, has been in existence for 48 years. And so that winner is Gina Lehman. If Gina Lehman is
oh my gosh, yay, I'm here. Yay, I had a feeling. I was like, I'm going to win these tickets. I love Southwest.
Okay, very
travel. I was in
Congratulations.
I'm so
Thank you so much.
Oh, I'm going to use them in December. We have a wedding to go to.
okay.
And I was looking at, because I'm trying to make plans with my husband to stay a few extra days. And so I haven't purchased them yet, but the prices are great. $79 one way?
Yes, we hope that many other people will see those great prices, starting as low as $49. So look on the website and book.
$49? Wow.
There's some low fares out there.
Okay. Very, very good. Well, thank you, Karen. We certainly appreciate you. And thank you for being a great sport and staying around and answering the questions, and of course, being the bearer of great gifts. So thank you so much, Karen. Ladies and gentlemen, as we kind of wrap this up, we hope that, our goal is for you to take away some knowledge, right? And so we hope that you impart, or when you depart rather, this webinar, that you're much more fluid about information around contact tracing, its impact, the education piece, as well as where the opportunities are. As we always do, here are some contact information of the folks that were on the webinar today. And again, we thank Herb and Jeff for what they do and for being here. And we ask that you join us again for our next webinar, which will be webinar number 10, I believe. This time, we're talking about how, and we just talked about the airlines, right? So how are these industries that have been impacted, how are they adapting? We look at the travel industry or the airline. We have Ricky Smith, President, CEO of BWI Airport, talking about the airport. Airports, travel, whether it was vacation travel or business travel, all impacted. He's going to talk about that impact there. Linda Thiessen, who is VP of Corporate Procurement for the Hilton. The hospitality industry was impacted unbelievably. And so we want to talk to the Hilton about where they're going, where the opportunities are. And Randy Conroy, he's a general manager or the senior vice president of and general manager of Horseshoe Casino, which is a part of Caesars Entertainment. You know that the casinos were just reopened up just maybe about a month or so ago. What is the impact on the entertainment industry? And of course, our favorite airline will be giving away more airline tickets. So we ask you to join us on Tuesday, September 15th, rather, 9:30 for another great topic. So you all take care and have a good remainder of your day. Thank you. Oh, don't forget.